May manok. May manok.
Sir Oliver. Sir Oli. Sir Oli. Yeah, can you please unmute your microphone, everybody, please?
Okay.
All participants, can you please unmute your microphone?
Okay.
Ben!
Yeah, please mute your microphone.
Mute or unmute? Ano sabi niya? Unmute.
Nadidinig ko kayo. Or 55. 4,000.
Ano? Puro pa, hindi naman ko pa.
Honest ako eh.
3,555 na lang. Sige po, minus pa.
Tingin mo na ng
Ayun ang parang.
Dagdag tuso pa nga yun yung...
Wow, elements. ATL.
Nangyayag ka nga eh. Oo.
Okay. Sure. Hello, bye-bye.
prayer for frontliners from a grateful nation. Lord Jesus, our Savior, you praised the good centurion for caring for his servant. Wrap our frontliners with your love as they risk their lives for people they do not even know. You healed the hemorrhaging woman by allowing her to touch you. Give our frontliners your peace as they touch so many frightened lives. You brought back to life the daughter of Jairus and returned her to her parents. Assure our frontliners the joy of returning to their loved ones as they serve you and save our nation. Already our transformation is happening as we witness their selfless dedication. Divine Healer, may their courage to face danger be not in vain. Please bless the work of their hands, that together with them, we may all know that you are God. Blessed Mother, our frontliners are precious to you, as they are to us. Let them rest on your lap when they are tired and find comfort in your embrace when they are weary. We ask all these and trust in Jesus' mighty name. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, pero sa silanganan, alam ng puso, sa likid mo'y buhay. Lupang binirang, kuyagan ang magiting, sa mandulubing, di ka masisigil, sa nagagang tutok sa simoy at sa langit kong pagaw, ay hiragang tulagaw, isang pagkayang minamahal, ang isang ang pagkawat mo'y tagumpay na nagiging, ang ituloy
Before we start our webinar, here are some reminders and guidelines for our virtual participants. First, please observe proper webinar and video conferencing etiquette. Also, please change your settings to speaker view. We are also kindly requesting all participants to turn off their video. You may post your questions regarding the lectures through the link flashed in your screen. Alternatively, you may also post your questions through the chat box in your Zoom console. Lastly, details on how to get your e-certificates will be flashed at the end of the webinar. We expect your adherence to these guidelines. Thank you very much. The Philippine Association of Medical Technologists, the only PRC-accredited professional organization for medical technologists, warmly welcomes you all to its free webinar series. This virtual event is held in partnership with Agappe Philippines. This webinar will entail in-depth discussions on the roles of and challenges to medical technologists, brought about by the COVID-19 pandemic in the Philippine context, and the impact and management strategies for mental health challenges among healthcare workers during the COVID-19 pandemic. Let us all welcome our session moderator for this webinar. She is a PAMET National Board Director and a fellow medical technologist. Ladies and gentlemen, Ms. Maria Rita Cristina Sebastian.
Good evening, everyone, and welcome to the PAMET Free Webinar Series entitled MedTech Experiences, Challenges, and Response During the COVID-19 Pandemic and Mental Health Awareness for Health Workers in Times of Pandemic. To formally start our webinar session, I would like to introduce the Chair of the PAMET Committee on CPD to give the opening remarks, Dr. Leila Lani Florento.
Good afternoon for participants from Philippines. Good morning and good evening to other participants from the different parts of the world. Welcome to our PAMET Free Webinar Series. Thank you for registering and participating in our webinar. This webinar is organized in partnership with Agappe Philippines. Thank you to Agappe Philippines for the opportunity to partner with you in this webinar. Today, the topic is about medtech experiences, challenges, and response during the COVID-19 pandemic, and mental health awareness for health workers in times of pandemic. This webinar aims to discuss the vital role of medical technologies as frontliners in the collaborative efforts to combat the COVID-19 pandemic, analyze the challenges posed by the COVID-19 pandemic on the practice of the medical technology profession and laboratory medicine in the Philippine context, discuss the stressors for healthcare workers during pandemic and other important psychological impacts, apply intervention to address the impact of the COVID-19 pandemic on the medical staff, and discuss strategies and support mechanisms to reduce specific work-related stressors and ensure the general welfare of healthcare workers. Today, we have two speakers for the webinar. One will talk about medical technologies versus COVID-19, the experiences, challenges, and response. And the second one will talk about mental health awareness for health workers in times of pandemic. So ladies and gentlemen, let us listen to the two speakers we have invited for this webinar. Thank you.
Thank you for that motivating message, Dr. Florento. Before we start, I would like to remind everyone to please turn your microphones to mute and to use the chat box or the link shown on the screen to post your questions to our speakers. To start our first session, I would like to introduce our first speaker. Our first speaker is a graduate of Bachelor of Science in Medical Technology as full academic state scholar from the University of Santo Tomas. He completed his master's degree in Business Administration, major in Healthcare at the Ateneo de Manila Graduate School of Business. Our speaker is a recipient of numerous national and international awards, such as the 2016 Most Outstanding Medical Technologies from the University of Santo Tomas, as well as the 2019 Asia Pacific Economic Cooperation, or APEC, at Santiago, Chile last September 2019, to name a few. He is currently the Vice President of the Asia Association of Medical Laboratory Scientists, Council Member of both the ASEAN Association of Clinical Laboratory Sciences and Asia Pacific Federation of Clinical Biochemistry. He is also a corresponding member of the Committee on Laboratory Management of the International Federation of Clinical Chemistry. The Vice President-elect of the Bioris Association of the Philippines, General Manager of ProLab Diagnostics, regularly seen on national television and social media, and a man close to every Filipino medtech's heart, to give a talk on medical technologies versus COVID-19, experiences, challenges, and response. Let us all welcome the PAMET National President, Mr. Ronaldo E. Puno.
Thank you very much, Ma'am Rita, for that really generous introduction. And good evening to everyone. Good afternoon, good morning, wherever you may be. So welcome to here, but I'll try to do my best to deliver it in the best manner I can. So this topic is entitled Medical Technologies versus COVID-19, experiences, challenges, and responses. So this is something very relevant to all of us because we all know that we've been in the front line since the pandemic came into our globally, when it arrived globally. So the overview, let me share with you that this presentation aims to provide insightful and meaningful information on and true to life experiences of medical technologies in their fight against COVID-19, particularly in a resource limited setting like the Philippines. It will also present local and home on how laboratory professionals cope up and continue coping up with challenges and how such dark and difficult situations gave light to the profession and brought medical technologies at the center stage of the pandemic. And of course, details on how the government, the professional organization, and the general public responded to the situation will be highlighted as well. All right. So I'd like to share with you before I start these words that came from Jack Ma, the head of the Alibaba Group. And he said that for people in business, 2020 is really just a year for staying alive. Don't even talk about your dreams or plans. Just make sure you stay alive. And if you can stay alive, then you would have made a profit already. And this is something really true, because nowadays, being alive, being healthy is already a blessing that we should really cherish. So my presentation will be divided into 4 parts. The first part will be a situationer, wherein I'll be sharing with you some latest data as to related to the COVID-19 situation, both globally and locally. What are the challenges we continue to encounter in our fight against this virus? And there are also some opportunities and learnings that came up as we fight the COVID-19 pandemic, and more importantly, what are the responses? What have we done so far? So let me share with you this latest update on the global tabulation in relation to the positive cases all over the world. And this particular write-up tells us that currently there are now about 10.6 million cases globally. And as of today, I think it already passed 11 million mark. And with that, I'd like to mention also that COVID-19 is one of the biggest battles the world has ever fought. And that is very, very true. Millions were infected and hundreds of thousands have died. And if you are here today, healthy and alive, and none of your loved ones has been sick or has died, then you are blessed. And there is so much to be grateful about. Still globally, you'll see, okay, this is the more recent figure wherein the total global tally is now at 11,015,514, and with the USA being on the top rank, and you will see that the Philippines is at rank number 39. Okay, so we're a bit at the tail end or at the middle part, but we should not be complacent, because if you look at the figures, it continues to increase, and as of the data, based on the data as of July 3, that's yesterday, we now have a total cases of 40,336. And of course, these figures change every day, every hour. Okay, so the total recoveries is now at 11,073, and total deaths of 1,280. And those figures were generated since the start of the state of calamity in the country on March 17, 2020. And currently, Philippines ranks third among the top Southeast Asian countries by confirmed cases, with Indonesia in rank number 1 and Singapore in rank number 2. Okay. Now, situation in relation to our medical technologies. But first of all, let me define who medical technologies are. And here, medical technologies are defined, also known as medical laboratory scientists, are the professionals who perform vital tests and analysis in clinical laboratories. They are also seen performing important examinations in research laboratories, in teaching, training, and supervising students in medical technology education programs. In the past decades, the practice of medical technology has evolved and expanded significantly, which now include molecular and cytogenetics technologies, nuclear medicine, forensic science, and perfusion, among many other emerging disciplines. And before, we all know that medical technologies work silently in the four corners of the lab, doing routine and special laboratory tests. But you'll see them wearing simple scrub suits, uniforms, and gowns. But of course, today is not the same anymore, because COVID-19 pandemic redefined the world of medical technologies tremendously and brought them to situations never seen before. And nowadays, many are wondering who actually does both the PCR and rapid test for COVID-19? And obviously, we all know the answer, the medical technologists. Nowadays, you'll see, and may, of course, all of us can relate to this, that everybody is now wearing full PPEs in whatever we do in the laboratory, be it a simple laboratory test, and of course, more especially when we are handling COVID cases or COVID samples. So also nowadays, laboratory professionals are being considered as frontliners. And in fact, it gave light on laboratory careers in many ways. And I'll be sharing with you some concrete situations and examples that provides some, at least some opportunities in relation to this COVID-19 pandemic. Okay, so as frontliners, of course, uh, we have several roles to play, and here I've listed some of them. And of course, among the top roles that we are now playing in this fight is on specimen collection. Of course, medical technologies are the ones who are collecting samples, the nasopharyngeal sample, and even oropharyngeal samples, and even those uh, conducting rapid antibody tests, okay, wherein we collect blood samples. And of course, the most important part here is uh, playing our expertise, okay, exercising our expertise as laboratory scientists in different types of laboratories handling COVID-19 samples. Many of our colleagues are also assigned as biosafety officers. Many are being invited to be part of the risk assessment team, particularly for those laboratories being considered to be a COVID testing labs. They are even considered as trainers in many aspects, and many other tasks are now being assigned to medical technologies. But among those pictures that I presented, okay, these are some scenarios wherein everybody can relate. Okay, so we have here blood collection, and we have here a sample collection for PCR. And again, among the many pictures that I have presented, this picture actually melted my heart. So you'll see here a medical technologist performing a post-mortem sample collection, okay, from a dead patient. And this is something that we should really be proud about on how important the roles of medical technologies are. And I salute this medical technologist in the picture. And I'm sure she is not alone. Many other medical technologists are doing the same noble role in this particular situation of COVID-19 pandemic. Now, let's now go to the challenges. So these are the challenges that we have listed in the course of our journey in fighting the COVID-19 pandemic. First, we have the surge in demand for testing. Then we have the high rate of infection among professionals. Of course, the shortage of personnel and the always hot issue on compensation and hazard pay, the lack of PPEs, discrimination, and lack of preparedness. So let me discuss briefly each challenge. Okay. First is the challenge on the surge in demand for testing. When the pandemic started some 6 months ago, okay, there was only one laboratory handling about 300 samples per day. If you still remember, the Research Institute for Tropical Medicine is the main government institution handling those cases. And during the early days, we were even sending samples to Australia and then to be returned after 3 to 5 days in order to get the result of a sample. Now, our laboratories are receiving as much as 30,000 samples, but though this is the target of the government, as based on the recently published data, we are only completing about 15 to 16,000 tests per day. But still, that is very much higher from the original 300 samples per day that we are doing in the lab. So laboratories now struggle to keep up with the COVID-19 testing surge. Okay. The next challenge is about the high rate of infection among health professionals. Again, the most recent DOH data tells us that there are about 3,390 health workers who tested positive to COVID-19 in our country. And even the WHO, in the earlier part of the pandemic, particularly in the month of April, was actually worried, okay, on the infection rate of our frontliners. Because obviously, if this will continue to rise, then the health system will be badly affected. And the Department of Health identified some of the reasons as community exposure, long shifts that led to high infection rate, and of course, the concern on the global shortage on PPEs. And one thing very interesting to know also is that out of that more than 3,000 affected health workers, as of my data here is a bit old because it was the latest data that I have last June 20, that we have about 122 medical technologists who tested positive for COVID-19. And I'm pretty sure that 2 weeks after, this data is already changed. But the only redeeming value here is that despite the more than 100 affected medical technologies, none so far um, has passed away. We have no case fatality for medical technologies. But of course, in terms of the number of physicians and the number of nurses that actually died in this pandemic, that is something very significant. Okay, another one is about the shortage of personnel, and we all know that the shortage of personnel was already here even before the pandemic, and it was because of migration, shift to a different work setting, like many medtechs are transferring to BPOs, online business, the high rate of infection, the fear of being infected, and low compensation. So even the Department of Health showed that trend in terms of shortage in health professionals, particularly on medical technologies. And this one, the low compensation and hazard pay, I know many will react on this, and everybody would want to hear what's new about this. So it's something to do with the fair wages and hazard pay for laboratory professionals during the COVID-19 pandemic. Okay. And the World Organization, okay. Another one is the lack of personal protective equipment. And the World Organization is warned that severe and mounting disruption to the global supply of PPEs caused by the rising demand, panic buying, hoarding, and misuse is putting the lives at risk from the new coronavirus and other infectious diseases. Okay, shortages are leaving frontline workers dangerously ill-equipped to care for COVID-19 patients due to limited access to supplies. And without secure supply chains, the risk to healthcare workers around the world is real. So in this CNN uh, write-up, it says that the medical group cites protective equipment lack for the death of 17 doctors. Still on the lack of personal protective equipment, there are several news articles that came out, like in lung center, okay? Sometimes in March, PPE stocks quickly depleted amid the increasing COVID-19 patients. And then the full room, supply shortage, understaffed shifts were identified as, again, some of the important challenges. In terms of preparedness, so this article published on April 2020, tells that many hospitals were not qualified to test for coronavirus. And that is very, very true. Practically, because this one is something that is very new, not only in the Philippines, but even globally. And the national government, according to the article, didn't immediately see the need to accredit qualified laboratories to test COVID-19 samples right after the first case was reported. And it was also mentioned that there was failure to think ahead. So in terms of preparedness, of course, we are talking about the number of available, functioning, and working molecular laboratories to do the PCR testing, the knowledge and skills in molecular techniques among our professionals, awareness on biosafety and biosecurity, and of course, competence in proper handling, management, and procedures. So another challenge has something to do with discrimination. Medical frontliners are literally putting themselves in harm's way to protect the greater Filipino population against COVID-19. And yet, in an alarming twist, an increasing number of them, instead of being accorded the hero's treatment they deserve, are being subjected to discrimination, harassment, and violence, mainly due to unfounded COVID-19 fears. And these are some of the real life experiences that we gathered as experienced by our frontliners. So in many situations, our medical technologies were not considered as frontliners. Many were gang up on and threw bleach all over the face of health workers on his way home. Some public vehicles declined to let medical technologies board. Some were barred from entering the residences. Some were evicted from eateries. Some were badmouthed or insulted. And some were not given access at checkpoints. And that actually triggered our campaign in our association to show to the world how important the work of medical technologies are. And in this picture, you'll see, and it's been going around the social media since the start of the pandemic, that medical technologies are not just exposed to patients with virus, but exposed to virus itself. Because we always say that being a frontliner does not only mean being always in personal interaction with the patient. So everybody should realize that interacting with the sample or interacting with the virus itself is even more dangerous. So, of course, there was stigmatization of coronavirus frontline health workers that's been happening all over the country. And one very uh, sensational case was the one that happened in Pasay City, wherein a Pasay City councilor berated and cursed health workers while testing the City Hall employees. So I'll be giving you some updates later on about that. Okay. And here are the write-ups regarding the healthcare workers who were attacked with bleach. Almost same scenario that happened in Sultan Kudarat Hospital, as well as the one that happened in Cebu. So here, stated here, although it's not a medical technologist, but a male nurse in a privately owned hospital based in Cebu was reportedly splashed with chlorine while walking along the street in Cebu on March 27, 2020. So these are something really, really sad because while we are doing our work as frontliners or as health professionals, many would do this kind of discrimination. How about opportunity? So of course, in these dark days and the period, some opportunities also came up. First is the awareness on the work and the value of medical technologies. Somehow there were some employment opportunities that also came out. It also strengthened awareness and gave more value on biosafety, biosecurity, and biorisk management. It heightened the interest on molecular techniques and in putting up molecular laboratories. And it also opened opportunities to lobby in improving the plight of medical professionals through advocacy activities and call for legislation. So when we talk of the awareness on who medical technologies are, okay, we've been hearing praises, okay, medical technologies being hailed as unsung heroes, silent heroes, modern day heroes. we've been getting several tributes, thanksgivings, and recognitions. So here, CNN also posted this poster stating, "Ever wonder who are behind the the coronavirus testing? Definitely not the doctors and the nurses. It's your not so known laboratory people." Okay. Even our president, President Rodrigo Duterte, on his address to the nation on March 24, 2020, said these lines that he reiterated his sincerest gratitude to all the courageous frontliners in this war, especially our health workers, our doctors, our nurses, and medical technologies and other allied health professionals. I know many of us rejoice, okay, by just the mere mention of medical technologies with the president of the country. It opened more employment opportunities somehow, because many government agencies hired additional manpower. We have here, of course, offering a good compensation. We have the Philippine Coast Guard, who hired at least more than 30 medical technologies, the Philippine National Police, okay, of course, the Department of Health, and even the MMDA, okay, and they are usually on urgent hiring because they need the medical technologies to be part of the health team to address, okay, the COVID-19. It also strengthened awareness and gave more value on biosafety, biosecurity, and biorisk management. That's why there are several interim guidelines issued by the different government institutions and organizations. Okay, biosafety manuals are now being prepared, or several trainings and webinars are being offered, and of course, several protocols are being issued. And that has something to do, of course, with the biosafety, okay, on handling samples related to COVID-19. And there is also now a heightened interest on molecular techniques and then putting up more molecular laboratories. That's why many hospitals are now rushing to be accredited as COVID-19 molecular laboratory. Then there are several diagnostic centers also opening up their facilities. Even local government units are putting up their own laboratories, different government agencies, and even universities. It opened opportunities to lobby in improving the plight of medical laboratory professionals through advocacy activities and call for legislations. So the mainstream media actually captured several situations that involve our medical technologies. And in our association, it also gave us the opportunity to, to express, okay, the concerns of medical technologies, okay, in different platform, in radio, in television, and in whatever available opportunity that we have. Okay. Now, what are the responses? So after hearing the challenges, after hearing the opportunities, it is very interesting to know now what have we done so far? What have the government done so far in addressing those concerns, at least those related to medical technologies? First, on testing capacity and the number of laboratories performing PCR tests, we all know that when it started, there was only one, the only official laboratory performing the tests was RITM. But as of July 1st of this year, we now have 54 RT-PCR licensed laboratories and still counting. We now have 20 licensed gene expert labs, and there are about 171 total number of laboratory applications all over the country, with the 87% of laboratories now at stage 3 and up. So we're hoping that once all these laboratories become operational, that would really be a big help everybody, of course, to the government, in combating COVID-19, because we really need to test more people. We really need to do more testing for our fellow Filipinos, because right now we are still lagging behind the other countries in terms of the number of samples tested. Okay, on discrimination. So the government intensified its efforts to protect the healthcare workers from harassment and discrimination by passing ordinances and directives in various local government units. So even the local government, the Department of and the National Bureau of Investigation remind the public not to discriminate frontliners. In one case here, the Philippine National Police even arrested 39 persons for discriminating frontliners, and Metro Manila mayors want to punish discrimination of health workers. Okay, so on low compensation and hazard pay, we all know that the Congress approved what we call the To Heal as One Act, which was passed by Congress to grant additional daily hazard pay to our health professionals and other frontliners, providing 100,000 pesos if severely infected by SARS-CoV-2, providing 1 million pesos in case of death, and providing additional premium benefits to our frontliners. So even different politicians actually back up the hazard pay for government COVID-19 frontliners, and nearly all Metro Manila residents want higher pay for our medical frontliners, according to a survey. On knowledge and competence and we saw the gap, okay, on in terms of the knowledge and competence of our professionals in relation to molecular diagnostics. So that's why there is now an effort to enhance, and even curriculum was reviewed by the CHED Technical Committee for Medical Technology Education, and the academicians are trying to strengthen. And of course, it's already included in the new curriculum, but of course, trying to find strategies on how this can be strengthened further. Of course, many other many training, certifications, and webinars were offered early on. Just to give an example, we have here the biosafety education and awareness training offered by University of the Philippines through the National Training Center for Biosafety and Biosecurity. It was actually offered for free, and I hope many of us were able to complete the program. It is a 16-hour a modular program, and another government agency that is continuously offering trainings and webinars is, of course, the RITM, and almost every week they offer related webinars. And one thing good also, even the PRC passed a resolution, two resolutions granting CPD units to almost everything that our professionals, our frontliners did, okay, in the course of their practice during the entire quarantine period. So just watch out for this particular specific PRC resolution, because anything that you did during your duty, okay, when you had your duty as a frontliner, when you for example, were assigned in a laboratory, or when you were assigned to collect sample, even if you are not attending a seminar, all those things will be given CPD units, and a lot more. Both the formal and informal activities that you had will be given credit. So we are just waiting for the specific guidelines related to medical technologies, but the CPD Council for MedTech has already submitted our recommendations, and of course, PRC was somehow impressed with the degree of involvement of our medical technologies in the different activities during this pandemic. On personal shortage, as we all know, there were emergency hiring of health professionals. And as mentioned earlier, some of them actually offered even higher compensation and benefit packages just to convince our professionals to be part of the team. So we have here like the emergency hiring by the DOH. Okay, so you'll see that it's a bit higher than the usual compensation that our medical technologists receive in a normal situation. On lack of PPEs, we are just very happy that there were several measures and several initiatives in order to address that issue. And here on the on the left side, you'll see a picture of some health health professionals and frontliners using garbage bags as their improvised PPEs, okay, in the early part of COVID-19. By collaboration, okay, the government and the private collaboration, the supply was improved and somehow enough for the needs, no, particularly of our frontliners, and many good, kind-hearted and good-hearted institutions actually donated lots of PPEs and other items in order to protect our professionals. Now, this is something that I'm really uh, very happy to share, and something that is really very close to all of us, because this will now focus on the specific response that our association has done in addressing this pandemic. So again, of course, our association is the only accredited professional organization for medical technologies as accredited by PRC, and representing the almost 100,000 registered medical technologies all over the country and even those outside of the country. So this year we have a very good theme, okay? The Vision 2020 and beyond, reaching greater heights for medical technologies of tomorrow. We didn't know that this pandemic will come, and at the start of the year we were so excited, and we were so positive in terms of planning. Everything is already set during the planning session. All the activities are already lined up, and just to be disrupted by this very big challenge. Okay. Now, PAMET as professional organization has this flagship campaign or program in relation to addressing and responding to the COVID-19. And we have this caring for the carers, and we have 10 phases related to this. Okay, first phase is the information dissemination. So it gives guidance and updated information about the recent developments related to COVID-19. So at the start, we were just providing some information, some updates, okay, on what COVID is all about, okay, at the early part. So we keep on sharing new information from WHO, from the Department of Health, and other respectable agencies. So that's how it started. Then, as we went on, the phase two was the advocacy on hygiene, wellness, and health standards. So this particular activity aims to drum up awareness on the importance of hand washing and other recommended minimum health standards in fighting against COVID-19. So here on February 25, okay, we organized a community program intended really to advocate the importance of hand washing. And we've been doing this even before COVID-19 pandemic came in. But of course, we felt that it's even more important to share and advocate the importance of hand washing in this time, because we all know that hand washing is the single most important factor in order to prevent the spread of diseases. Okay, so so these are some of the infographics related to the importance of hand washing and other health-related practices. Then phase three is advocacy on the role of medical technologies, and it now highlights the important roles of our professionals in beating the virus in various capacities. So here we've uh, posted several inspirational messages related to the practice of medical technology. So we have here stating that medtech was a career that has traditionally been overshadowed by more visible professionals, which suddenly came into spotlight because of the world's interest in coronavirus testing. And the one on the right tells us that the time has finally arrived for public and those in healthcare to truly understand their value to saving lives. And clinical laboratory professionals are the doctor's doctor. Phase 4 is about hospital and laboratory visits to provide support and assistance. And this particular activity is something that is really very close to my heart because I personally supervise and I personally joined the team in visiting our hospitals and laboratories, at least in Metro Manila. And it aims to provide immediate assistance to medical technologies in terms of PPEs, health and hygiene kits, disinfectants, alcohol, and even food packs. But of course, it was through the generosity of our partners and donors. So what have we done out of this? So more than 400 hospitals and laboratories receive assistance. That's covering not only NCR but even laboratories and hospitals all over the country. Some schools and communities also benefited out of this. There were over 20,000 medical technologies reached, and more than 50 items were distributed. It also covered 16 cities and one municipality in Metro Manila, and more than 40 provinces through different PAMET chapters. And in Manila, Metro Manila, we've covered about 140 hospitals and laboratories, of course, through the cooperation of the different clusters in Metro Manila, because we have 6 clusters as under the Committee on Laboratory Management. So, and it is still continuing right now. We've not stopped it so far, and there are several chapters still doing the campaign, and we're just very happy that in our own little way we were able to share our blessings or even some support and assistance to our colleagues. Okay, and phase 5, which is still ongoing, is the financial assistance to COVID-19 positive medtechs. This is a new program as well, and it aims to provide financial assistance, though may not be that big amount, but it helps to alleviate, it aims to alleviate the burden of medtechs who tested positive for COVID-19. Okay, so what is it all about? So for all our active members who tested positive for COVID-19, regardless of the severity, everyone is will automatically receive 5,000 from our association, and right now there are almost 50 beneficiaries who availed, and this may be availed until the end of the year. So if you know someone who may not know about this program, maybe a fellow medtech in the laboratory who's an active member of our association, please tell them that we have something for them. Okay, just a simple way of appreciating their contribution in this fight against COVID-19. So these are the first 3 batches who received. Okay, because we want it delivered personally during the first few batches. During the time there was no traffic yet because there were no mass transpo. But now what we're doing is to just coordinate with our colleagues and ask them how we can give the assistance to them through bank deposits. So it's of course available not only in Metro Manila, but even to our colleagues who are in the provinces, in the chapters. The first phase 6 is the provision of continuing professional education and development of guidelines, and it aims to provide new information and knowledge related to COVID-19 through webinars and online trainings. So just like what we are doing right now. So since May, we've offered a series of free webinars, absolutely free to all our participants. So There were PAMET-initiated webinars. There were some locally collaborated webinars, some internationally collaborated webinars. We've also invited local and international speakers. And we are now in the process of developing relevant guidelines. So this one, PAMET, BIRA PAMET Biosafety Guidance on COVID-19 testing for laboratorians. We are currently developing this, and it in about a month from now. And we are just hoping that each laboratory, at least all the hospitals and at least up to the secondary laboratories, will receive a copy of this guidance, and that will be provided to all of you for free. And of course, we've hosted several other webinars, like in partnership with another organization like the BioWaste Association of the Philippines, and some internationally collaborated webinars. We've just completed the third AACLS, the ASEAN webinar, last June 27, and there is another one coming because we'll be hosting the second webinar, the Asian webinar of the Asia Association of Medical Laboratory Scientists. So these are all being provided to us for free. So we would really want you to continue learning, despite the quarantine period, despite the COVID-19. Nothing can stop us from learning new things, particularly on those related to COVID-19. Phase 7 is on anti-discrimination campaign and response, and it aims to seek support and to help prevent discrimination practices and to protect frontliners. This actually emanated from several reported incidents of discrimination all over the country. In fact, we've released this another infographics, and this is something to do with the safety on interacting with medtechs. Okay, so we really need to educate people, okay, because many are having a wrong notion on the work and the safety when they interact with medtechs and other health professionals. Well, of course, I'm sure many of you, or if not all of you, have heard or at least saw or read something about the incident that happened in Pasay City, okay, wherein the councilor was involved, okay, and wherein he insulted and actually discriminated, no, our medtechs together with other healthcare workers, because during that incident, not only medtechs were there, but even doctors and midwives. So that led us to the uh, release of our official statement that actually condemns that kind of action towards our health professionals, with the aim of supporting and protecting our colleagues in the profession. Okay, so in relation to that, also a complaint letter was sent to the office of the city mayor and to the Department of Interior and Local Government, and it was actually captured by the mainstream media. And maybe during the time, maybe you've heard so much about the issue through the several radio and TV interviews, wherein I had to defend, of course, our colleagues. And just to give you an update on this, last week, said councilor together with the medical technologists and other health workers involved were actually summoned by the National Bureau of Investigation. And I'm yet to receive, or I'm yet to get an update from those involved on what actually transpired in that NBI meeting. On phase 8 is about media visibility. We feel that this is very important because we know that beyond the product endorsement, strong media presence provides public awareness on the work of our professionals. And we are just happy that nowadays our profession is being recognized, being noticed, and being given enough airtime in order for us to express, okay, what we need to tell to the government, to the officials, and whoever is concerned, to the politicians, to the Senate, and even to the Congress. So we were able to appear in a CNN program. Okay, UNTV even publish uh, video specific for the roles of medtechs, and GMA through their radio station also had its time in terms of discussing the issues and concerns of medtech. Phase 9 is the appeal to the government and politicians. And I'd like to allow me to give more details of this part, because I would really want to share this part to all of you, so that everybody would know, would be aware, would be educated, and would understand that your association is doing its best in order to address the different issues, okay, related to our profession. Okay, so let me share with you a letter. This letter was sent to the office of the president on May 11, 2020 in Malacanang. So you can read here that I actually, yeah, this is my message when I sent the letter, stating that we are submitting a letter to the office of the president regarding the concerns of our medtechs. And on June 3, we received a reply that this will be uh, handled and will be given attention once the ECQ is lifted. And that came from the Presidential Complaint Center. So we will continue to make a follow-up so that we would know what we can expect, okay, out of that appeal. And let me share to you the letter in its entirety, because maybe some of you were not able to read it, and I feel this is a very good opportunity for us to share, for me to share the content of that letter. It's a bit long, but please bear with me, because it has something to do with each and every concern the medical technologies would want to address. So let me just read parts of it. So of course, in the first paragraph, I mentioned who a PAMET is. And on the second paragraph, I mentioned that the work of medical technologists, medical professionals who perform the vital tests and analysis in clinical lab, which I already mentioned in the first few slides of this presentation. So here, I also mentioned that during the COVID-19 pandemic, medtechs played very critical roles in handling numerous cases together with other healthcare professionals. Many of them were tasked to collect samples from suspected or probable patients through swabbing or pharyngeal or nasopharyngeal specimens, or through phlebotomy for blood specimens, assuring that quality tests are done and reliable results are produced. They also exercised their expertise in laboratory testing, but the rest of healthcare team relied on the test results they provide. The extent of their competence and capability cannot be underestimated. Some medical technologies with expertise in biosafety, biosecurity, and biorisk management are also included as members of the risk assessment and validation team who evaluated laboratories being considered to be COVID-19 testing centers. And it cannot be overemphasized that as frontliners, medical technologies were among those who sacrificed in combating the SARS-CoV-2 virus, the causative agent of COVID-19. Then next part tells us that while we commend the heroic deeds of many of our professionals, it is a sad reality that medical technologies remain unnoticed and unrecognized in terms of proper compensation, benefits, and protection. In many instances, they were not even acknowledged as important members of the healthcare team. For these reasons, many of our professionals opt to leave the country and live and work abroad for better opportunities, while many others decide to pursue other areas of practice not directly related to medical technology, and thus leaving a vacuum in our healthcare system. And if the government wants medical technologies to stay and serve the country, then they should be properly taken care of. And we would like to reiterate that in the efficient and effective delivery of healthcare services, there are also medical technologies who risk their health and lives just to perform the duties they sworn in. And then we specifically mentioned what are the concerns, the valid and specific concerns of our professionals. First of all is the compensation. Okay, the letter states this is actually the actual letter that we sent to Malacanang. First is the compensation, and this is a major concern of our professionals both in government and in private sector. Because while salaries of other professions have been upgraded, that of the entry-level salary of medical technologies remain at salary grade 11, the level where it was since 1989 or more than 30 years ago. And the strong clamor is to have an entry-level salary of at least salary grade 15, both for private and government institutions. This appeal has been submitted and resubmitted several times through legislative bills and position papers for many years now, but efforts remain unsuccessful. And it's about time that medical technologists be given the reasonable compensation they truly deserve. However, this particular concern is not new. Okay, looking back, I would like to share also that it did not happen overnight. It did not happen only because of the pandemic, but the association has been working on it, and it started to be included as part of our proposed medical technology bill since 2011. So as you can see, the history of the several bills filed, always that particular portion on compensation and salary of medical technologies were there. From 15th Congress to the 18th Congress, the more recent one last year, that particular appeal has been there. And in order to enhance, okay, in a position paper that we also submitted in 2019, that in order to enhance the general welfare commitment to service and professionalism of medtechs, the minimum base pay upon entry of a registered medtech in government and non-governmental institutions should not be lower than an amount equivalent salary grade 15. So that was the first appeal. That was the first item. And moving forward, I would like to share also, though we are still finalizing the version, that the new bill would also want to, again, we are resubmitting a new version of the bill, which you will also be which will also be shared to you in due time. We are of course appealing for salary grade 15 for our medical technologies, and that is cited in section 34 of the latest draft of medical technology bill in 2020. And again, it covers not only government, but even those working in the private institution. The second item that we are appealing to the Office of the President is about the hazard pay and safe working conditions. So we appeal here, so I will not read it in entirety, just the last portion, but we appeal for stronger directives for intervention or legislation mandating concerned institutions to provide standardized hazard pay and full protection to medical technologists and other healthcare providers, again, both in private and in government sector. Okay, and again, as part of our proposed medical technology bill for 2020, okay, we are we are we are including the concern on hazard pay and other health and safety entitlements of medtechs, both for those working in the government and in private healthcare institutions. Third is about the plantilla position, and what's stated here is that many of our medtechs remain to be employed as job order in different levels of government, whether national or local. While there is an effort to strengthen health human resource, this must be complemented with employment security by creating plantilla positions to be filled up with qualified professionals. And due to lack of plantilla positions, our medical technologists, in their desire to get employment, are left with no choice but accept available lower positions, such as laboratory technicians, even though they possess higher qualifications. And finally, is we are appealing for a support to amend the medical technology law, which of course is now is now on its 51st year. So it's already 51-year-old. And we mentioned here that the expansion of practice, the emergence of modern technologies, and the demand for higher level of competencies and expertise warrant the passage of a new medical technology law. So in closing, I mentioned here that PAMET is confident that positive actions and measures taken to address above stated issues will boost the morale of our professionals. This will also uplift their self-esteem and improve their commitment and dedication to work. And through the strong advocacy of the government on universal healthcare, we are hoping that the cries of medical technologies will be finally heard. And it is also expected that once proper compensation and benefits are assured and better protection is provided, many Filipino medtechs will rethink their career path and consider staying to serve the country and eventually contributing to nation building. And it was signed by yours truly. Now, uh, we did not stop there. Okay, we also had an audience with some of the politicians, particularly um, Congresswoman Janet Garin. If you know, Congresswoman Janet Garin was a former Secretary of Health. And incidentally, she was also a previous sponsor of a medical technology bill. And we talked about what could be done in terms of expanding the benefits for healthcare workers. So some are stated here on your screen, just like I'd like to give emphasis on here on the proposed measure. On the first item here is extending the benefits of RA 7305 to private frontline health workers in times of a pandemic or public health emergency. So again, there is a plan to expand, okay, the benefits not only to the government healthcare workers, but even for those working in the private sector. And here it's I apologize for the screen because it's a bit blurred. But of course, I would like to emphasize that during that consultative meeting, I made it a point that we were able to raise the same issues that we've been raising here. And as you can see here, as highlighted, we're pushing for the amendment of the Medical Technologies Charter or the law. And the key concerns for medical professionals, which I mentioned to the the Congresswoman Green, that needs to be addressed are number one, compensation, number two, hazard pay, number three is safe working condition, and number four is discrimination during performance of duty, which are somehow similar to the appeal that we sent to the office of the president. And finally, on legislation, we know that the advent of COVID-19 opened the eyes of many legislators, and it led to filing of several bills in Congress that seek to upgrade the practice and benefits of medtech in the country. And we are now closely working on the final version of the bill that would amend the current medical technology law. And of course, there is also one bill in the Congress that was submitted by Congressman Biason, seeking to upgrade the salaries of health professionals. So in this picture, you'll see that PAMET has been closely working with the Philippine Society of Pathologists, wherein last February 22, we had a joint meeting, and as again highlighted here, among those discussed and mentioned were the salary grade of the medtechs, the composition of the board, and other relevant issues, of course, affecting our practice. And we are hoping that the final version of the bill will be jointly agreed upon by these two organizations. And the association has been continuously meeting despite the pandemic over virtually. We've been meeting regularly, okay, in order to talk about the law, the medical technology bill, which hopefully will eventually become a law. And this one, this bill that I'm mentioning is the House Bill 6766, which was sponsored by Congressman Biason, an act upgrading the minimum salary grade of health workers in government hospitals, research institutions, and local government units. And as you can see here in letter F, medical technologies are also included. Okay, for final thoughts, let me say that things that are happening around us could definitely affect our mental well-being, which will be our next topic. Stress, worries, uncertainties, disappointments, anxiety, and unverified information are some of the factors that we should watch out for. Negative thoughts and criticisms are fast becoming a new normal for many. Words unworthy of professionals are uttered in various ways and forms. Many statements are taken out of context. Social media use is being abused. It's not wrong to fight for one's rights. What's wrong is if it leads to discrediting others without checking the facts. And not just because you're right doesn't mean I am wrong. You just haven't seen life from my position. So let's all work together, and we are one PAMET. Thank you very much. Be safe always, and together we can beat COVID-19. And before I finally end this talk, I would like to request all of you to watch the video, which we've already played in the past, but I think still relevant up to this time. So please enjoy the video, and thank you very much for listening. And for any question later on, I'll be very much willing to answer. Good evening to everyone.
The world is facing chronic shortage of personal protective equipment.
Now that the world is fighting against the pandemic brought about by COVID-19, we as PAMET, with its local chapters nationwide, are called upon to do our share in our own little way, to show how we care for everyone, and we are proud that PAMET is at the forefront. It is the best time to let our medical technologists and other frontliners feel that we are here to support, to inspire, to encourage, and to lift their spirits in this very difficult time and crucial battle. We believe that by being strong, being united as one, we will win this war against COVID-19. Together, we can make a difference. Together, we can make a better world. And we are proud of you, our PAMET chapters, leaders, members, and volunteers.
There comes a time when we heed a certain call, when the world must come together as one. There are people dying. Oh, when it's time to lend a hand to life, the greatest gift of all. We can't go on pretending day by day that someone somewhere will soon make a change. We all a part of God's great big family. And the truth, you know, love is all we need. Beyond the world, beyond the children, beyond the words will make it brighter than day. So let's start giving.
There's a choice we're making. We're saving our own lives. It's true, we make a better
must lend a helping hand. We are the world. We are the children. We are the one to make a brighter day. So let's start giving. Oh, there's a choice we're making. We're saving our lives. It's true, we make a better day, just you and me. When you're down and
What a very touching video. Thank you, Pamet, and thank you, Mr. Puno, for that very insightful talk. Indeed, medical technologists, not only in the Philippines, but also all over the world, share almost the same dilemma, problems, challenges, and experiences with the COVID-19 pandemic. Again, I would like to remind our participants to kindly use the chat box and questions link to post your questions to our first speaker, which will be addressed later during the Q&A portion. We will now be starting our second session. And let me introduce our second speaker. Our second speaker is a graduate of Bachelor of Science in Nursing from San Juan de Dios Educational Foundation, Inc., and is a graduate of Master Arts in Psychology and Master Arts in Nursing from the University of Santo Tomas. She has presented 2 researches internationally during the International Union for Health Promotion and Education in Pattaya, Thailand, last 2013. Our speaker is also the co-editor of the published book Elsevier Mosby, Psychiatric Mental Health Nursing, Philippine edition. She has earned experience in planning, implementing, and budgeting in the field of middle administrator. She is currently the lead internal auditor for ISO Quality Management System at St. Mary's Academy, Pasay City, and is a practicing psychotherapist. To give a lecture on mental health awareness for health workers in times of pandemic, let us all welcome Ms. Julianne Alonso Balmonte.
A pleasant good evening, everybody. We are here to discuss about the mental health awareness for healthcare professionals in a time of pandemic. As the COVID-19 continues in rampant run across the Filipino communities, it is predicted that cases of anxiety, depressions will spike. The country mental health care system may be totally unprepared, especially in us as a frontliners who dealing with the patient, taking care of the patient in terms of their illness. My topics will be the definition of mental health, the impact of COVID-19 pandemic on the medical workplace, the psychological impact for the healthcare workers, and the intervention to stay mentally healthy. Mental health, the state of well-being where we can realize our potentials, coping with normal stressors. Right now, we are able to experience different kinds of stressors in our work, in our families, in our relationship, live and work fruitfully and make a contribution to the society. So as a frontliners, as medical health workers, like medical technologies, you have to contribute many things in the society to fight this kind of pandemic. Even though you are not the one fully take care of the patient, but still you are one of the frontliners that very, very important in identify those who are COVID positive. So if we are mentally healthy, we are feel well, think well, and act well in spite and despite of stressors that we experience. Even though we are struggling, like what Sir Puno said a while ago, struggling for discrimination, struggling for those uncertainties of what we will have right now, how it will end this pandemic, how we able to see those our fight for this kind of viruses, what will be our contribution, how it will stop, and those are the questions that we usually think and feel right now, and realize our own potentials. So as we able to see that we are mentally healthy, we realize that we are potential in doing our part. Being a medical technologist, we do our part in identify those COVID-19 patients, and those are right now at risk themselves, conducting throat swab, even the postmortem care. These are our potential as one of our contribution to fight this kind of pandemic. Are able to cope with normal stresses of life. So what are those stressors? Sometimes we are burned out our work because of our 12 shift, sometimes 16 hours shift, or even 24 hours shift. So sometimes we experience that nobody will relieve us from our shift because they are afraid to go out anymore because of the threat that being surround us because of discrimination happened to our country. Plus that we able to stress out with being a burnt out in our work, seeing a lot of slides every day, by diagnostic every day. Aside from addressing the pandemic, we also have concerned different things, like the different kinds of diseases. We're also concerned right now that the rainy season will come. What will happen if the peak season of dengue will also arise? So that's all. Those are the stressors that we sometimes we cope, okay, and we need to fight to become healthy. Work productively and fruitfully. Okay, so even though in spite of those stressors or those problems that we encounter, we work hard, we do our best to become, do our job productively, to address our concern, to address those concerns of our patient, and to give the right readings in terms of laboratory reports, and contribute to our community. So what will be our contribution as a medical technologies? Like what Sir Punot said a while ago, you are less recognized, okay, because your life work in the laboratories, but your work are so essential in fighting this kind of pandemic, because without you, without the medical technologies, they cannot identify who are among those positive and negative, who among those are really doing well or not. So your contribution to our community is really relevant in fighting this kind of pandemic. The influence of mental health. Safety work conditions. So let me see. In the hospital, in the structures, some of the hospitals already hire a psychologist, okay, to address those concerns in like the anxieties that we able to experience every now and then. The anxiety that may we go home, that we are safe in our family, that when we go home, that we are capable to serve again for another term, another month, another year. That when we go home, our health in a good conditions. Employee insecurities. What are those insecurities that will eventually help in mental health? So what are those securities, like the workplace that in your right now that you're fighting, the uh, the compensations in terms of your hazard pay. Okay, everybody have that. Plus, what were those employee security? Your PPE, that everybody have that. Okay, inclusive workplace, etc. So, if in case there's some hospital also provide, okay, when their employees already done their duty for 2 weeks, so 2 weeks relief. Where do we usually stay? In the hotel, or sometimes they provide a certain room for them to be safe enough to gather those structures. Next, the community, the sense of belongingness. That's why we came in some discrimination. That's really the problem right now, the mental health of being discriminated. Okay, when you go home, are you safe going home? Are you safe traveling? Are you safe going to your family? When you see in different news, like example during the time that during the ECQ, people tend to discriminate health workers. Sometimes even when they go home, they cannot hug their family. They cannot see their family in terms of sense of touching, because they perceive that they might transmit the disease when they hug them or kiss them. So access to social support. Are there your community have social support within your community, within the hospital, within your family members, within your society? Sometimes we tended to have that. As a Filipino workers, okay, even in abroad, we have that kind of social support. We, in spite of there are a lot of cases that mortality that happen, especially in other country, Filipinos support one another in terms of crises. That our significant attitude, okay, significant values as Filipino. Freedom from negative environment. Freedom from negative environment. How do we come out with that kind of freedom? How their environment really avoid discrimination? How the community avoid some kind of like the one that you can see something negative comments, okay, to your colleagues or sometimes to the people around you. So freedom of negative environment, but we cannot because we live in a not perfect world. We can still encounter negative communities, negative social support, okay? Sometimes we also not feel that we are sensed to belong to that community. But the ability to deal with the thoughts, okay, as commonly, okay, as Filipino, I just want to emphasize this. As a Filipino, we have a good positive outlook. We are managing some negative thoughts to positive one. We can do this, like what happened to different type of um, happening. What happened last year, Yolanda. Okay, those are the things that we encountered, but still we struggle to come out to be stand alone. Okay, to fight those things. So manage life and cope. How do you manage life? How you manage your life? By coping, like what usually do when you see these people around person who are sharing their thoughts with their friends, sharing their thoughts with their family. Okay, so that's how we manage and cope with this kind of pandemic. Good physical well-being, like enough sleep. That's why we tended to have what 12 shift, then after 12-hour shift, we will have or two 1 week straight. Sometimes after two weeks straight, then we will be off because we need some physical rest. Because if that will happen, okay, some of our like other frontliners, like the doctors, okay, died because of too much burnout, okay, stressful of their kind of their work. So to maintain those mental healthy mind, we have to take care of our individual self by have a good rest, by keeping ourselves to cope with different type of stress, and to come out with a community which is united, which is capable to give help to one another, and the structures which will protect us from any danger and harm. So what is the impact of COVID-19 pandemic on medical workforce? What? First, the resources. First is the shortage of protective equipment and when faced when critical ill patients. Even though that we are exposed in the laboratory, we tended to somehow pay less in terms of shortage of protective equipment. But these are part of our what? These are part to protect us from the danger of the pandemic. But at least, okay, there are a lot of like the PAMET help, okay, the other hospital, okay, the other to give some protective, even NGOs, okay, the non-government organization to help to ease the shortage of the PPE, okay, give a free for those healthcare worker to protect themselves from to face this kind of pandemic. Next, balancing physical and mental health need of workers. How do you balance physical health and mental health. So we have to need a rest and enough rest for us to regain our energy. We need to have a good balanced diet, okay, to regain our um, nutrition. Okay, we need also an ambience of a good relationship from one another in terms of mental health, in terms of our when we feel some anxious, when we feel when we feel depressed. Okay, there are certain workers that you can ask for the help. Okay, you can embrace them. Okay, just listen to them is enough. Sometimes they just want to burst out some of their worries with their families, with their works, okay, with their priorities. So just listen to them is enough for them than to verbalize their feelings. And how do you do that? Okay, just attend a listening ear. That will help. Not just be a good friend from them, but being a really co-workers in terms of the um, crises. Okay. And next, how you do it? Progressive depleted workforce due to illness and isolation of staff. Right now, there are a lot of healthcare workers are depleted in workforce. There are people tempted to work more than 12 hours because some of them already uh, infected by this virus. Some of them need to double their duties. Some of them they need to stay long hours, okay, to compensate, okay, to the loss of those staff or being isolated because of this kind of pandemic. And the incident of hostility and even aggression towards medical personnel, like what Sir Puno said a while ago, there are a lot of discrimination. And the bad things that we experience, if we really experience that within in our organizations. Okay, so I think there is nothing that happened, okay, within the organization that we able to experience hostility and aggression. So sometimes because of our burnout, okay, because of our too much work, we tended to lose um, care to ourselves, and we tended to lose the care to our patient. So we are just rooting out. Okay, there is no love or a sense of caring. Okay, because we are rooting to our work. Okay, we are used to that kind of work. So there is no touch of care anymore. Okay, there is no touch of a humane care in our perspective because we are exhausted in our work. We're exhausted with our physical problems. Okay, so that's how sometimes we experience aggressions and hostility of medical personnel. Sometimes even a small thing, it can be aggravated by certain anger. Okay, that's not the cause. The cause is just you are stressed of something, or you are stressed with your work. You want to rest. That's why it resulting to aggressions, or it sometimes it resulting to misunderstanding of both medical personnel. Okay. Aligning patient's need with family. So remember, as a Filipino also, we are really concerned with our family. We are family oriented. We are always go with the concern of our family, especially if you're living with a patient or with a family who are older, okay, who are vulnerable in this kind of diseases. They are concerned about their family, being worried about them, especially for those parents, okay, their children, they're working as a medical frontliners, like you as a medical technologist, how they pray for you, worry about you, they how they will able to see you after your work. Okay, so those are the concerns that you really worried. Or if you are married, frontliners, how can I see my daughter? How can I see my son? How do I I cannot hug them. Okay, I need to stay in the certain area, okay, 2 weeks before I have to go home. But I miss them. But those are the things that you really worry about in line with the family members. Afraid to taking virus home and infected family members. Okay, because you will feel guilty if ever, okay, one of your family members are been infected because you are the one who carried that. So you will resulting to blame. Okay, you will blame yourself. Okay, that resulting to a certain mental um, stressors. Okay, depressions towards the health frontliners. Those are the concerns that really you will see in different area of different countries. Okay. Isolation from family, from other support. Like example, you're being isolated for 2 weeks. Then you do not know how your family, okay, you just give them a call, okay, a video call or a telecommunications. Okay, but that's not enough because as a family member, we need to see them, okay, personally, hug them, okay, see them if they are well enough, okay, prepare their food. If you're a mother or if you're a father, how are you able to give them the care of being a parent or a care to become a daughter of the or the son of your parents? So those are the things that really, okay, lead to us to mental depressions, okay, lead us to stressors, and lead us to somehow can jeopardize our work in terms of concentrating and giving us the best that we can. Care for severely unwell patient. Lack of effective treatment for unwell patient. So what are those things? Like for example, okay, lacking for people who can recognize the disease. Okay, we are too much of identifying those person who are eventually have that kind of diseases. Okay, but because of the lacking some of the instruments that we need to do, okay, and should be treated immediately, but it's not being treated because of such um, uh, delay of transmission of some result, okay, because of not enough resources like the materials, the people, etc. So these are as a medical practitioner, even as a medical technologist, we want more really effective and efficient in our work to deliver, okay, to identify immediately those infected patients so that we can give them the immediate care that we need to give them. Staff struggle to deal with patients who were unwilling to be quarantined. Okay, somehow there are patients also. Then even in the news, you already hear that there are some patients also, okay, go out like a prisoner. They escape from that kind of isolation because they do not want, okay, to be tagged as a COVID patient, or sometimes they also scared, okay, to what will happen or what will be experienced outside world. There will be discrimination that will happen when they go home, when they leave, go back to their communities. Now, what are the psychological effects impact for the healthcare workers when we experience those struggles, those depressions, those stressors, those burnout, even sometimes that they lead to post-traumatic experience? What is psychological distress? Okay, a major workplace mental health problems around the global that could be associated with several symptoms. So what are those several symptoms? First, nervousness. How do you come up? What will happen if I go home? What will happen if I will not put my PPE? What will happen if the PPE is not enough to my staff? Okay, what I will spill this virus? What will happen? Okay, so those are the things that you need to overcome, okay, in terms of psychological distress, so that you can work efficiently in terms of your work area. And then fear of the disease. Yes, everybody feared the diseases. the fear that we are unknown. We cannot see in our naked eye. So how every day, every time that we go back to our work, the fear that you will acquire for that kind of diseases, the fear that after a week that you will be one of the positive, okay, that you will be included in the numbers of those positive cases. Next, the sleep problem. Okay, sometimes when you go home, okay, you have sleepless night because you think over your work, you think also the patients of your care, okay, you think also the other coworkers that you already experience, okay, that lead also to inattention. So when we say, if we're able to experience psychological distress, we are now inattentive towards our needs. We are now inattentive towards our colleagues of our work. So how we can able to deliver efficiently and effectively if we have psychological problem. So if those kind of symptoms that you notice to your colleagues, okay, please help them. Then depression is quiet. Sometimes we experience depression, but we cannot recognize it. We do not want to recognize it because we know, okay, as a Filipino, there are different perspectives. We do not want to see something that are negative, okay? Sometimes we need to admit that we experience psychological distress so that we can help each other to cope with mental problem. So what are the psychological distress? First is the risk of infections. The healthcare workers are confronted daily with uncertain reality that they themselves are regularly exposed to potential culprit and the risk for spreading the virus to their own family and colleagues. So spreading, that's the one that make us depressed or stressed, okay, in terms of relating to our family and in terms of relating to other colleagues. Next, the sense of helplessness. When we say sense of helplessness, who lack of access to the beds or equipment they provide to provide patient with best care they can. Because we need to have the best care with the patient. You know, I can feel you because as a frontliners, as a medical technologist, you want again, okay, to give all those results as fast as you can, appropriate, okay, a current result, okay, to identify so that it will ease the fear of the community, even the society, in terms of how many really the affected patient. Okay, so because there are limited sources, because of limited materials, so you feel sense of helpless. I cannot do anything more, but I can do my best to identify those things. But because of those scenarios that we experience, we feel helpless in dealing with that. Okay, person protective equipment to protect ourselves. Sometimes even though we want to complete our PPE, okay, even though we are not exposed to the patient, but we are exposed really the virus itself. Okay, directly you are really exposed to the virus itself. So you really need to have this kind of protective personal protective equipment, your PPE. So because of those lacking, you are really exposed to that kind of diseases. So there are forms of moral injury. What are those moral injury? As a medical practitioners and the frontliners, we want all our patients to heal. We want our patient to go back to their home. Okay, we want our patient to restore their life. Okay, they are forced to make medical choices that would normally involve patient family members without that critical input because patient loved ones are forbidden from entering hospital. Especially as a Filipino, okay, we want, if so there's somebody to have experienced critical care, we need them, okay. So how do we support? By give them telecommunication, given the message to their family members. But that's only things that you can do. We cannot allow them to get in because that it can be elicited, okay, to increase the case of the pandemic. So those are limited, okay, in our terms of our moral issues right now that can lead to psychological distress. And lack of social support. While stress is higher than ever for frontliner workers, coping mechanisms that involve social support are largely unavailable as a result of policies around COVID-19. Who among you co-workers, some the hospital really employ some psychologists, some hospital also employ every week counseling, okay, for those frontliners to ease their worries, to ease their stress, to ease their depression, okay? Because there are also, according to some research, okay, there are a lot of frontliners who commit suicide. What is the cause of the committing suicide? Because they feel helpless. They feel that they cannot cope with the distress that they feel. Okay, they see a lot of patients who's dying. They want to help. Okay, but there are something that they cannot do anything. Okay, so as we experience right now the pandemic, as a frontliners that every day we experience this kind, what will be the intervention to make us or to stay mentally healthy as a frontliners? First, mitigate the negative psychological. Okay, so provide practical support. What are those practical support? Support include developing, implementing infection control measures. Like in any hospital, you have your ISO, okay, you have your accreditations, okay, your things that measures the how you give, okay, how you protect yourself from dealing with the patient, from dealing with the laboratories. Okay, there are a lot of protocols. So there are also measures that given, okay, to handle this kind of pandemic. Next, reduce work intensity by offering more medical staff. But right now, I think it quite visible, okay, to address this. Okay, that's why the DOH really, okay, encourage some healthcare professional, okay, to apply, okay, because they really need a work medical staff in laboratories, in hospital, in any areas of the hospital. They need really right now. So they offering a certain uplift, okay, of their salary, okay, in terms of their commensurate of their risk. Okay, so this one will also reduce some practical support. Next is to provide practical guidance. What are those practical guidance? Okay, so after your work, okay, you can rest, okay, then chat for your friend, okay, then do some things that you want. Example, if you want to do sketching, okay, that's help also to give you a positive, okay, mental outlook. Do the things that are not usually do in the hospital. When you work, okay, do whatever the task that you done in the hospital. When you go home, then do the tasks that you need to do in your house. Okay, do not think over what are the problems that you encounter in the hospital. Online platform to provide medical advice. There are a lot of given, okay, some psychologists given a free counseling. Okay, some of the hospital, okay, also give counseling under medical frontliners. Even the others, okay, any frontliners, they give it a online platform to ease their stress, to ease their depressions. Okay. And number two, proactively identify those who are suffering. So if you experience psychological distress right now, you already feel nervous, you have less sleep, okay, you feel depressed, okay, so you are now at risk that you can have psychological distress. So if you feel that you already have that kind, you can ask your immediate head, okay, tell them, or you can ask a friend, okay, or ask for a certain professional help, a free counseling if you have in your hospital, like psychologists, okay, to do some debriefing, okay, to ease your distress, your stress and your depression. Monitor them. especially if you're head of the organization. If you're a head, monitor them. How are they? As a head in your office, okay, just telling your staff, how are you? Okay, how are you doing? Every day you give them smile. Okay, that's one thing that you can monitor them and give them the positive outlook of their life and uplift their spirit, their self-esteem, especially those who are struggling, okay, right now. Provide relevant support. What those relevant support? Like giving them, okay, assistance, okay, like what PAMET doing right now, assistance for those who are victims, okay, for giving them, provide them, okay, initial support, which is your colleagues, okay, give them immediate needs, like the other hospital, they provide foods, they provide shelters, okay, for 2 weeks stay in their prospective hospital with free accommodations. Okay, so those are the things that you can do. So what are the platform for actions of maintaining mentally health? First, healthy work policy. So if you do not have that kind of healthy work policy, then it will come out. What are those things? Are not only we need to uplift also our professional knowledge, but also we have to need also we uplift our mental health. We need a good work policy in terms of our um, addressing our mental issues. Okay. Next, creating supporting environment. Who are the support group in terms of there is a problem? What will be the who will be the one you call? Okay. If you have psychologists who what are the toast times or there's a certain support team in your organization, example in a laboratory, okay, that one of your colleagues, okay, there are certain problems, they already experience psychological stress, then you can create supportive environment. You can give them chat, okay, a little bit of stressors, okay, to reduce their stress, like example, giving them sometimes listening to them, giving them some advice. Okay, strengthening workplace and community to take action. So how do you take an action to give an immediate policy and have a good community in terms of avoiding discrimination? What will happen? Okay, if you encounter that, what will the company or the management will address that? So how the community, if ever you experience mental distress, what will be the protocols? Okay, in terms of addressing those things. Okay, and developing personal skills. So that's one thing to enhance your personal skills. Okay, how do you, because some Filipinos do not are afraid to initiate, afraid to tell. Okay, sometimes even though they are right, okay, to their own perspective, but they are shy to give their insight. So you have to develop your self-confidence and initiate in a right way, okay, of your own ideas, okay, and criticizing of one a good perspective. Okay, so that's it. So that's how you develop a mentally healthy workplace in times of pandemic. So thank you very much for your accommodating, and thank you for listening to my talk.
Thank you for that very informative lecture, Ms. Balmonte, and for teaching us how we, as frontliners and health workers, cope and deal with stress, as well as take care of our mental health with the current pandemic. We will now be opening the floor for the question and answer portion. I will now read some of the questions posted by our participants earlier to be addressed by our speakers. So for the first question, I think this is intended for the first speaker. The question is, how does PAMET intend to safeguard our medtechs from discrimination in society and the workplace during this pandemic, knowing that we are at the forefront of this health crisis?
Okay, so thank you very much for that question. Well, actually, since the advent of this pandemic and since we've been getting information or reports related to discrimination, PAMET has been working so hard in order to address that and to protect our people. And one way of doing that is, of course, we are trying to bring that up to first is we want the public to know what's happening through media visibility. If you remember during the incident in Pasay City, which I mentioned, I personally appeared in the media and appealed for better treatment for our professionals. And we did not stop there. And in fact, I also mentioned that the specific incident that happened wherein our frontliners were discriminated it's still ongoing. Okay, the investigation is still ongoing. However, we would like to make it part of our legislative measures, and we've been safeguarding the safety and the welfare of our medical technologies. And if you can see, I presented in one of my slides that among those new provisions that we're including has something to do with the protection of our professionals.
Thank you, Sir Ronnie, for that answer. Our next question, how come DOH doesn't approve RDT or rapid diagnostic test as standalone test?
Is that addressed to me?
I think anyone can answer, sir.
In the first place, I don't think I'm not I'm the one who's authorized to talk about it. But as far as but based on the information that I got, the reason why DOH is not approving the rapid antibody tests as a standalone test is because of the possibility of false reactions. So we all know that PCR is still the gold standard, and based on studies, there's a good percentage wherein during the rapid antibody testing, there's a possibility that we get a high percentage of false negative. And that is practically because we all know that for rapid antibody testing, what's being tested is the appearance of the IgM and IgG. And in the course of the infection, we all know that antibodies appear within the first week of the onset of the infection. And if we miss that, and let's say we do the testing early on, let's say on the first and the second day, there's a possibility that we'll not be able to detect the presence of IgM. And that could lead to, of course, mistreatment or missing the presence of an infection.
Thank you again, Sir Ronnie. I think the next question is intended for our second speaker. And the question is, are there any report or news that will support the claim that frontliners have committed suicide? If yes, here in the Philippines and abroad, can you provide percentage of frontliners who have committed suicide?
Okay, so committing suicide as a frontliners, in other countries, yes, there are about 5% in terms of dealing with those stressors that they experience right now. But here in the Philippines, they're just experiencing depressions, stress, anxiety, okay? That sometimes they eventually tended to not go back to their work, okay? Because they already experienced some traumatic, okay, that need to be addressed. But good thing, okay, as a frontliners during this pandemic, they haven't I haven't seen suicidal tendency, but in other countries, yes, they have. One of that is the nurses committed suicide under the pressure in London. Okay, they commit suicide after she experienced a lot of patient who died. Remember the peak of the death during that time. So they already struggle. Okay, because of that, they eventually lead to suicidal tendency. Okay.
Thank you, Ma'am Julianne. I think the other question again is intended for you. And the question is, there are some medical technologies colleagues who experience sleepless nights. What are your recommendations regarding having a good night's sleep?
Okay, so first, okay, what is the reason? What is the cause of sleepless nights? Okay, if there is certain problems that they need to think, kasi what the common things that you do not want to sleep, okay, you are worried about certain issues with your families, with your colleagues, okay, with your works. Okay, second, if you really have problems physiologically, you have insomnia, okay, but if psychologically, so how do you address that? You have to admit that yourself that you have problem. Okay, you need to admit also yourself that you need to work into that problem. And if you can tell to your example, if you're married, okay, if you can tell to your husband, what will I do? Okay, what are the things that I need to address these issues? Okay, so you can tell that, then you can talk about it. Okay, but if you do not want to know by your family member, to whom you have to address that kind of issue, to your friends, or if not, okay, you can call, okay, a certain NGOs, okay, or a psychologist eventually, to ease your stress, okay, their problems, then eventually to voice out and to address what are the things that you have to do to avoid sleepless nights.
Okay. I hope the participants took note of that. Thank you, Miss Julie. Another question for Sir Ronnie. Are the medtechs in private institutions included in the CPD exclusion of PRC or only those hired by DOH?
Can you repeat, please? I'm
The
having,
question,
yeah.
sir, is, are the medtechs in private institutions included in the CPD exclusion of PRC or only those who were hired by DOH?
Okay. I'm not so sure if I got it correct, but there's a word CPD exclusion. I don't know exactly
Yes, sir.
what it means. But maybe the participants is referring to the granting of CPD activities for the different activities that we had in the course of our practice. Yes, yeah, both those working in the government and private sector can avail of that particular opportunity. The technical committee, I'm sorry, the CPD Council for Medical Technology already submitted the different activities that we're engaged in, whether you're working in the private or in the government sector. For as long as you participated, for as long as you had your duty during the pandemic, definitely you can avail of that. It doesn't necessarily mean for government only, but both government and private medtechs may avail of that. And anytime soon, we are hoping that PRC will already sign the resolution specific for medical technologies. But rest assured that we've exhausted all possible activities that we're engaged.
Okay, thank you, sir. I think, sir, there is a follow-up question
When you
regarding
let's say when you yeah
yung yes, sir. The follow-up question regarding CPD exclusion, are the OFW medtech OFWs also included in the CPD exclusion of
Yes.
PRC?
Yes, that was specifically included in our recommendation, and it's already been reviewed by the commission, and everybody will be able to enjoy that opportunity. So it's a very extensive lineup of activities that you participated in. Even on activities that you've done while you're at home, when you, let's say, volunteered to prepare some PPEs, or let's say face shields, or you improvise face shields. If you've been part of that, if you've been part of a volunteer work, those are all included in the activities that may have CPD credits.
Okay. Thank you, Sir Ronnie. I think a lot of our participants are really interested and would like to be enlightened regarding the CPD exclusion, because another question is, how about laboratory technicians? Are they also included in the CPD exclusion?
Yes. For as long as you're a PRC, yes, for Yeah. So for as long as they are registered laboratory technicians, they are included.
Okay, thank you, Sir Ronnie. And I hope our participants took note of that. Another question for Miss Julianne. What
Yes.
possible strategies and recommendations could be implemented to manage the stress of medtechs in terms of increasing work responsibilities and exposure to some traumatic incidents, especially now that we are on pandemic? I think they're trying to ask how to manage the stress of medtechs in terms of lots of workload, because now most of the hospitals, especially the big hospitals, they experience uh, the shortage of manpower because now we don't have medical technology interns.
Yeah.
Yeah. So I think
Okay.
that's the question, ma'am.
Yeah. There are because of lack of uncertainty right now, right? So set your mindset that you really right now we cannot avoid I mean we need to extend our hours, okay, our work hours, because we do not have interns and right now, okay. So you reset your mindset that this will what will happen. I need to strengthen my health, okay, my in terms of 16 hours or 12 hours, how many hours that I need to do, okay. So example, your habit before is after your work you play, or you uh uh, you tended to play games, okay, to ease some stress. Okay, what is important is to do your you still what is important is to do your habits still, okay, in terms of managing your stress. Para pagdating sa if ever if in terms of your work relationship, okay, you will uh, give release the stressor in your area, like learn to say no if ever, example you learn to say no if you tempted that you feel that you are not really at good of your health, that you really need to rest, okay, it's okay to say no, that sir, I need to do some things, okay, or I need to do something to some relaxation, or, or need to address things first, then you do some relax. If you feel stress, okay, in your workplace, have a deep breath, inhale, exhale, or sometimes, okay, you can have a short break but not leaving your area, okay, just or thinking something positively, okay, just setting a good set of mind, kasi we cannot avoid anything, we need to accept what already happened right now. That's
Thank
all.
you, Ma'am Julie. And last question for you. How to deal with a toxic workmate that meddles with everyone's personal life?
Oh,
I think,
oh,
ma'am, that's common
yeah.
in any type of
Okay.
work environment.
Yeah. Okay, how you deal with that? Ignore first. Okay? Because you know yourself. You know yourself better than they are. Better than them. Okay? You know your work ethics. You know what are the things that you have to do. Okay? They usually say if you do your work, there are a lot of people envy you. Okay? Okay, so first, do not disturb yourself from those negative comments, because it will also lead to your negative attitude, and it will also trigger some negative relationship. Okay, so if you know that kind of comment is really not you, okay, it just creating a negative environment, then just leave, okay, because sometimes people tended to identify you if you just always uh initiate them to to look into your problem, okay, because you also given them the authority to mingle to your life. But if you just ignore them, okay, they will stop eventually, because sometimes this person is ignore me, or uh, can handle those things. Okay, so if you will keep on if you will just keep on uh, uh, saying those things, okay, and parang in Tagalog, patulan, okay, that will eventually lead to chaos, okay? So leave it there, okay? Because we cannot avoid those kind of employees, okay, co-employees. They are part of our system, okay? But they will eventually learn from their mistakes, okay?
Thank you, Ma'am Julie. And I think the last question is for Sir Ronnie. Are medical technologies in private laboratories included in the salary grade 15 of the new MedTech bill?
Okay, so it's a big yes. Actually, I'd like to make it clear that even as early as 2011, when we started submitting a proposed medical technology bill, those working in the private sector are already included. So in one of my slides, that's the reason why in one of my slides, I presented the history of the submission of the medical technology bill. The reason that we've been getting several reactions, sometimes even bashing, negative reactions, and stating that the association is not helping our professional, and they would like to dispel that wrong notion. That's why I would like to emphasize that whenever we make a comment, whenever we make a post, just make sure that we verify our facts, because that could be misleading and that could lead to some negative reactions. Yes, definitely government and private sectors are both made part of our proposal. We never forget our colleagues in the private sector. And my only appeal, because maybe this is the last question for me, my only appeal to our colleagues is that it's really not bad to fight for our right, as I mentioned. But one thing that I would like to appeal to you is that we should work hand in hand. We should work together, and we should not discredit, okay, the organization, particularly on the works that is doing for our professionals, because even history will tell us that we've never sit down on it. We've been working so hard for it. Those people who know the people, who know the leaders of the association, know how we exert much effort, exert much time. We've been exploring all options, all possibilities. We've been appearing in social media, in the mainstream media. We've been lobbying with the government officials, with the politicians, with the Senate, with the Congress, and whoever that can actually help us. So that's an appeal from the association, from me in particular, because it's very hurting to hear people talking based on unverified information. So let's not be swayed by the information that we get out of social media, because that is really, really very dangerous if you don't know the real story. So that's my message for all of them. Thank you.
Thank you so much, Sir Ronnie. So unfortunately, due to the interest of time, all other questions will be entertained later on. Once again, thank you to our speakers, Mr. Puno and Ms. Balmonte. To give the closing remarks, I would like to call on the sponsor of this webinar session, the Country Manager of Agappe Philippines, Ms. Jenny Decena.
Hello, good evening to everybody. Good evening to every unsung modern hero that is present in this webinar session. Before I begin with, I would like to extend our heartfelt gratitude to all our medtech warriors who are now the country's primary weapon against this invisible enemy we are fighting. Agape Diagnostics virtually salutes all of you. In this regard, we at Agape Diagnostics would like to set aside business aspects for the moment, and heed to our moral obligation to support our laboratory personnel who has been our ally for many years. We would like to thank PAMET for giving us this opportunity to be of service to our colleague in this time of need. Before this momentous event, our team has already spearheaded some projects whose bottom line is to support our frontline workers. Being a manufacturing company of in vitro diagnostics, the procedure that produces a wide range of products in hematology, chemistry, coagulation, pre-analytics, urinalysis, and immunochemistry, and a factory that caters to more than 60 countries worldwide. We have capitalized for this international channel network to reach out to our heroes and make them feel that although this battle is far from over, they have our support. We are also happy to announce that aside from the known stability our reagent product line has to offer, like what we are seeing now in the screen, like albumin, SGOT, the basic chemistries, and the special chemistries. We have also doubled our production for known parameters that supplement COVID-19 diagnosis, like D-dimer and C-reactive protein in our MISPA i3 cartridge type protein analyzer. We also take pride in the reliability of our principles of protein testing and amalgamation of nephelometry and immunoturbidimetry, so linearity and accuracy of results are all monitored. We also boast in special features like unique channel shifting technology, smart calibration cards, cartridge type system, where we understand that in this crazy times, the last thing you want to worry about is a faulty machine. We join the country in praying that this pandemic will end soon. We all know that our experts are still devising a way to beat this virus. Until then, an accurate testing facility, our precautions, our positive outlook in life as per discussed by Miss Julie, and lastly, our faith will keep us alive. Again, in behalf of Agappe Diagnostics Switzerland GmbH, Agappe Diagnostics Philippines team, and Pharmastar International Trading Corp, thank you, Sir Ronnie, and the whole PAMET organization for giving us a chance to be of service to your prestigious association. It has been an honor for me to share this virtual stage with such prestigious names like in our profession, like Dr. Leila Florento, Sir Oliver, Miss Rita, and of course, Sir Ronnie and Ma'am Julie, our speakers for the day. And to our colleagues, we salute you, we support you, and we are all praying for you. Please enjoy the rest of the evening and let us all stay safe. Thank you very much.
Thank you, Ms. Decena, and of course to our sponsor, Agappe Philippines, for making this webinar session possible. Before we end, I would like to give a brief synthesis of the topics tackled earlier. Our first speaker's presentation provided insightful and meaningful information of the journey and true-to-life experiences of medical technologies in the Philippine setting. We learned of different types of health workers' discrimination, acts of bravery and heroism in times of pandemic, struggles in the different laboratories, and best practices of our fellow Filipino medical technologies and health institutions in their fight against the worldwide pandemic. Our first speaker also reminded us that our organization, the Philippine Association of Medical Technologists, is here with us in this battle against COVID-19 to help and support medical technologies nationwide with PAMET's numerous campaigns, projects, and programs. Our second speaker's lecture reminded us that health workers are not exempted from mental health conditions, much more stressors brought about by the pandemic, such as adapting to the new normal lifestyle, and managing the fear of contracting the virus, as well as worry about people close to us who are particularly vulnerable. Our second speaker also taught us how to cope and overcome these stressors, how to take care of our mental health, and how being aware of the different signs and symptoms of depression, anxiety, and other mental health conditions can help save the lives of people who are experiencing these circumstances. At this point, we would like to thank everyone for being a part of this PAMET webinar session sponsored by Agappe Philippines. Details on